Welcome to season 2 of the Hacking Hypermobility podcast.
Let's get the episode started with a quick update on our lives.
Yeah. So, what have you been up to, Luna?
Well, I'm doing good. I'm on some new shit. I saw the Taylor Swift concert. That was the highlight of my life. But I've been coming out of autistic burnout and recovering from a breakup that was, last year. A little bit of a emotional processing delay. So now I'm hyper focusing on dating as a neurodivergent woman. That's fun. But I've mainly been working on regulating my nervous system, supporting my baby zebra, just kind of making sure we're doing okay with all the things. What about you, Shelley?
Well, let's see. Right after we posted that last episode, COVID finally got me. I got denied disability, but I did get in with the POTS clinic at Johns Hopkins, and some of their recommendations have been very, very, very helpful. And I have a follow-up soon. Oh my God, I can't believe I didn't mention this at the start. Oh, wait, before that, okay, both of my kids are adults now, legally anyway, which is weird. Also, I am a partner in a little business known as Two Bendy Mommas LLC. So that's some big news.
We're official.
Official. We are officially incorporated in Maryland or organized in Maryland. And our mission is to advocate, support, and inform those who have been involved in medical trauma or are late diagnosed neurodivergent type people. That's not how it's worded. It's worded so much better.
We were much more eloquent.
Yeah, I winged this. I winged it. It's been.
You're not whinging, just winging. We're good.
Yeah. So that's big news. That's big news. Yeah.
That's awesome. Thank you, Shelley, for doing that, by the way. That was a Shelley thing. We also have some other really big news for the season.
Yeah.
But I don't want to surprise it.
You don't want to surprise it?
Yeah, that's not it. But I don't want to ruin the surprise. Where it's hard.
We did this on a Monday. We did this to ourselves.
Well, we have really big news for this season of Hacking Hypermobility, but I don't want to ruin the surprise. So let's just get started with our guest, okay, Shell?
Okay.
Tiffany, I think it's time we officially welcome you to the Hacking Hypermobility podcast. We have a producer.
Yay!
Cheers.
Very, very excited and happy to be here.
We appreciate your help thus far, getting us out of the burnout hiatus and all of that too. Are you okay with just jumping right into letting us get to know you?
Yes.
By us,
I mean our homework.
I think we know you a little bit, but maybe we'll learn some things. So one of our focuses for this season is to hear from other voices besides just Shelley and myself, to kind of gain a better understanding of how people go through this journey and maybe get some helpful insight to share, pool resources and ideas, that sort of thing. So we're working on interviewing other zebras, just regular people like us. I'm going to start with a broad question. Can you share your journey on how you were initially diagnosed with Ehlers-Danlos syndromes or connective tissue disorders and how you came to that diagnosis?
Sure. I'm still new, like pretty newly to the point where it's on my file, but never and doctors well, but nobody has ever explicitly said this is exactly what you have, but it's in my chart. And other doctors are like, well, it's just Ehlers-Danlos syndrome. And so it still feels very weird to me. Both of my, that's in my horror stories. Yeah.
You were diagnosed at 40.
So 40.
So this is
on paper at 40.
It's pretty fresh. But when did you first see signs and symptoms where it was becoming that problem? For you?
Unknowingly, childhood. It started but you didn't know.
You attributed it to something else.
So of course. Yeah. And especially just being a female, and typically when you go to the doctor and they like you're either overweight or anxious, which I was both. So a lot of the things that I had going on was just attributed to either being at like, for example, when I hit puberty, like around 11, is when the POTS symptoms started kind of getting a little
Yeah.
bit more intense. But we didn't know it was POTS. I was always told like you're just out of shape. And the last couple of years has been like this huge mind-blowing thing where it just dawned on me. I was like, I was never out of shape. I danced for like 8 years. I played volleyball. I played softball. Like I was incredibly active. And I was overweight BMI wise because I was so muscular because I played so many sports. I swam. I grew up in South Florida, so like the ocean, and that kind of did a mind on me, like a mind number, because I was just like, I've never been taken seriously, and how much of this could have been not avoided because I know that it's a progressive thing, but how much could I have prevented and slowed
Further.
down? So that's why
Yeah.
I was just like, I need to figure this out for my girls now. Like it was imperative. I'm
At what
sorry.
age did they first tell you you're overweight and anxious? It wasn't 11, right? I could, or was it?
Yeah. Oh,
Oh,
yeah.
wow. Okay.
I remember going to a doctor at 9 o'clock or 9 o'clock, 9 years old, and they put me on a diet at 9 because my BMI. And now I look back at pictures of myself as a 9-year old and I'm like, I'm healing a lot of like the childhood stuff because I'm like, I was never like, it
Yeah.
wasn't, not that there's anything, you can be healthy at any size. Like, I'm a firm believer, like, you can be healthy at any size. But think like late 80s, early 90s, even though I wasn't,
Hmm.
yeah. So I remember it was like monitoring what I ate and like, you can eat a pickle, but you can't have, it was just like, that was my first introduction to like, there's something wrong with my body. And I started looking at it differently.
So
Yeah.
obviously, you internalize some perceptions about your body and things you may have been failing your body. How does it impact your daily life now?
It changes on the hour, honestly. It feels like there's some days where I wake up and I'm like, I'm also really bad at like introspective thinking. Like I'm so used to things that I don't notice things anymore. So like right now my neck is killing me and I don't notice until I actually have to sit and think like kind of like a head to toe inventory like what's going on with me today because it's just such always in the background that I just tune it out. I think now again it depends like I've got some tummy issues as well, like some autoimmune ulcerative colitis. So that I haven't been able to figure out a pattern yet. So, but a lot of times it's a lot of joint instability or stiffness. Like it's one or the other. It seems like I'm either like super bendy or I can't close my fingers because they're so stiff.
Yeah.
And within a day, it will be like I'm super bendy in the morning. And then by nighttime, it's, and I can't pinpoint it. So the unknown of my day is always like the most frustrating thing to me, I think.
So it wasn't anxiety, but do you still experience some emotional struggles balancing all of this?
Yes, incredibly difficult. So the diet back to like the diet, how like I died, like diagnosis came about. A lot of little things over the time. So like when I was 22, back to 11 is the first time my knee subluxed. Like I vividly remember it. Was playing soccer. I bent down the wrongest way, and my knee popped out of place. So went to the hospital. Like they're like, oh, you just, you strained your knee, whatever. And it kept happening. Like, and I would go to the doctor. I'd be like, my legs really hurt, like my leg muscle. And they're like, well, what do you expect? You play sport. In the same breath that they would be like, what do you expect? You're very active. You play sports, you dance. That's why your legs hurt. Also, you're overweight. So it's like within that same breath, it was like, you need to exercise more, but the exercise is causing you pain. But it's just a cycle. So it wasn't until I was like 22 when I went to an orthopedic specialist and actually had an x-ray done of my knee and showed him like in his office. I was like, I need you to listen to me. I can't carry a load of laundry upstairs without falling because my knee keeps subluxing every time I squat down. and it sounds like spaghetti noodles, like dry spaghetti. And so they finally did an X-ray and an MRI, and he was like, "You've got like the legs of like someone in their late 60s or 70s." He's like, "You're covered in arthritis." And he's like, "Also, your knees misaligned." I was like, "What do you mean?" He was like, "Your legs are hypermobile." He's like, "So even looking at you, I can say you're at least 15 without even no goniometer measuring." He's like, "I can see you're at least 15 degrees, probably more. And also your kneecap subluxes because your ligaments are so loose and your kneecap is misaligned. So every time you get bend past a certain point, it jumps off the track. So
That's physics. Yep.
for at least, yeah. So for at least 10 years, daily, I was jumping off the track many times a day. But that was the first time, like, some kind of validation where I'm like, something's not right. And a doctor actually listened and been like, well, let's check it out. What could we do?
When was, like, how old
I
were you?
didn't know. 22.
What was the solution offered to you at that time? Like
I had a
going
surgery.
forward. So you had surgery
Yeah.
to do the realignment.
Yep. So they did a realignment. I was in a wheelchair for 2 months.
That was bilateral.
And then I was in like a walker and PT. No, just one.
Oh, okay.
So was that the first
But
time you
because
got,
I was so unstable.
was that the first time you got an accurate hypermobility diagnosis? Was that experience that led to surgery?
He just said my knees were hypermobile.
He didn't really
Just the
like
knees.
go.
They didn't do any exam.
Okay.
No.
You had major knee
Yes.
surgery. That was the first time you even heard this word, hypermobile, but it really was just in the context of this is what's going on with your knee. It wasn't in terms of a systemic issue or collagen disorder or
Yes.
anything like that. When did you finally talk to a healthcare professional who understood EDS?
Fully understood? Probably haven't.
Or who
So
said,
I didn't
hey,
know, like, I
more.
Improperly knew about it. And what I mean by that, like 2018, when I was like 35-ish, I can't even do math right now, mid-30s, I was working at a place and one of my coworkers just happened to notice how I sit because I was always like in the office chair, like in these weird yoga-y positions. And I went
I
to a
don't know
party at her
anyone.
house. I'm sorry?
I said, I don't know anyone that sits weirdly.
You started saying that, and I was like, I really need to move. I do not feel good.
I know this whole time. I'm like,
That was like that was
Anyway.
honestly the thing when I first found you guys, when I saw Shelly's TikTok and I saw Shelly sits weirdly, I'm like, is she one of us? Like one of me? Because I'm like, I didn't ever thought I sat weirdly until like many other people were like, why are you
until
sitting
people
like that?
started
Like, doesn't that hurt? And I'm like, what are you doing?
No,
And
this
like,
is the
it was
best.
cool when we were kids, right? Well, it wasn't cool because we would get corrected, but like eventually it started to stick out more as you got older, right?
Yeah.
Yeah.
Like when you're at work
Yeah.
and they're like, why are you like that? And I'm like, why are you
Yeah.
not?
Right.
Yeah.
No, that's not what I said. I was like, okay.
So
Yeah.
what was
So
the journey to find
ship
a
time.
professional that was actually able to like look at you as a whole person and say this is a connective tissue disorder and it's not just your knees, it's not just these symptoms we've stacked up? Because the diagnosis ended up in your chart. Somebody had to have been like, oh, this is what this is, right?
The first time I heard, so the coworker, I was at a party, her sister has EDS, like to the point where she's like the kind that can hold the soda can backwards, like all the party tricks. She saw me standing, and because my knees hyperextend so much and it's very obvious, she came up to me and she was just like, "Are you Tiffany that works with, my friend, her sister?" And I was like, "Yeah." And she goes, "She's told me about you." She goes, "You do go backwards." And I'm like, "This is weird." Like right off the bat, like this is our initial meeting. And I'm like, "Yes, I do." She goes, "Look what I can do." Does her party tricks. And I'm like, "Oh, that's crazy." She goes, "Are you a zebra?" And I'm like, "I don't know
You're
what
like,
that means."
is
And
this
she's like, "Have you
Halloween?
ever heard of Ehlers-Danlos syndrome?" Yeah, and
But
I was
like
like, no, I have
everybody
no idea what
else,
you're
you were
talking about.
diagnosed when a zebra in the wild was hunting. It was like, you're one of us.
Yes,
Yeah.
because she also knew about my tummy trouble. Because of her talking with her sister, I guess she's like mentioned a few things like behind, not mean, but like behind, like I think there's a zebra I work with, you know. So that was the first time I'd heard of it, and I'm like, I have no idea what that is. I'll go look it up because I'm big into like research everything. If I don't know, I have to find out. And I remember crying, like
That's a
reading
clue.
through it because I'm like, it was like a light bulb moment, like just reading about, and even then I didn't know how flexible, like apparently my entire body's hypermobile to a certain degree.
You
I
just
didn't
can't
know that things weren't normal.
atypical. Yeah.
Yeah, I was doing like they were like, "Oh, this is the Baton score." And I was just like, "See if you can do this." I'm like, "I don't know, can I?" "Oh, I can." And it just made sense. And I didn't like get too into it because this is before a lot of the research that's come out over the last couple of years came out as far as like the comorbidities and things. Like I think this is just right around the time where it was like starting to catch on, where it was like, "Oh, it's not just bendy. There's other stuff."
Yeah.
So I brought it to my primary doctor, and he went over the checklist from the Ehlers-Danlos Society with me. And he's like, "Yeah, you definitely meet the criteria. I'll send you on, go to rheumatology. I'll give you a referral." I said, "Perfect." So I wait 9 months for a rheumatology appointment. And then I go, and he was like, "Well, yeah, you have it, but it just means you're bendy." And it wasn't put on my chart. It was generalized hypermobility is what he put on the chart,
Mhm.
or joint hypermobility. But he was like, "I'm going to refer you to genetics to make sure, to just check a subtype." And then genetics denied me, and that was the end of it. Like I didn't look into it anymore after that because he was like, "It just means you're bendy." And I was like, "Okay." Like um, and it really didn't pop up on my radar again until I have to think that super sick in 2020 from for my other conditions I have. Um, so I didn't know if it was just stress
And
from that or switching to becoming a full-time mom of two who were in pre-K and kindergarten. I just thought everything was just stress related. But then it got worse and worse and worse. And then it was like all the physical manifestations of the co-conspirators started popping up. And it took almost 2 years for somebody to actually listen to me as far as like me saying something's wrong. Um, to the point where I made out a will and I was like recording things because I felt like I was dying and I couldn't get anybody to just sit and figure it out with me. So I started taking pictures. I started doing a lot of research on my own because I'm like, there's got to be something causing this. This isn't how I feel. So then I found out about drug-induced lupus. I brought it up to my dermatologist and I was like, I need you to listen to me. And I showed her pictures and she was like, "You're absolutely right. This is not right." When I was, so when I was doing the homework for this, I was going back through like my chart and like looking at notes of things. So at that appointment, I didn't know this. She even said, "Unclear etiology, although constellation of symptoms does suggest an underlying connective tissue disease versus inflammatory polyarthropathy, especially in the setting of UC and other autoimmune conditions." So my dermatologist, I didn't know any of this. Like I just went and read the notes. My
She didn't
dermatologist
mention
was
that to
like,
you?
"Sounds like connective tissue disease." Mm-mm.
So you went through all of
She,
that. She mentioned it might be drug
mhm.
induced, but she didn't say there might be an underlying connective tissue disease when she told you the other things?
No, I'd mentioned it. No. I think I'd mentioned it to her before, like a previous appointment, like, "Hey, this is what's going on." Like, because it just had hypermobility, and she was like, "Oh, okay." But no, she ran all the tests to check for like drug-induced lupus and lupus, which everything came back like off the charts. So then I got to rheumatology, again, a different rheumatologist, and they diagnosed me with fibromyalgia. and said that it wasn't drug-induced lupus, that because I have autoimmune disease, that it was probably preclinical, even though like my ANA, everything was like sky high, like off the charts. And then I went back to my dermatologist and my gastro, and I was like, can you please do an antibody test for Humira? Because my rheumatologist is just saying it's just fibromyalgia, and I don't accept that. Like, I can't wrap my head around it, because there's so many physical symptoms. Like, I was having like hives. I didn't
Yeah,
know it
that
at the time,
diagnosis
but it
doesn't
was
make
like
sense.
not for
That's an
everything that I
easy
had. I'm
way.
like, this
Yeah,
doesn't
that's an
explain
easy out.
this. Yeah. So I had a lot of trouble swallowing that. And so I was like, no, I don't accept that. So they did the antibody test. Turns out I was having a severe reaction to the Humira. So I had to stop that. But even then, I was like, that still doesn't explain everything. Like the POTS, which I didn't know was POTS, I haven't been diagnosed with MCAS. That's possible. Right now, they're just putting it under like histamine intolerance issues. But I was having those like anaphylaxis reactions all the time. I couldn't figure it out. At one point, I was diagnosed with alpha-gal, because I had a tick bite, and it came back that I showed markers for alpha-gal. So I went like
Oh.
quasi-vegan for a year, just no mammal products, and I still have the markers, but they were like, something's going on. I'm like, I know.
Hmm.
That's what I'm saying. So it's just now all starting to come together, and things are kind of
What were
making more
like
sense.
these signs that you were experiencing that they were missing and attributing to these like other possible things besides the joint issues?
Hives, random hives. I would get dizzy, like the typical POTS. It's mine is mostly like getting from the ground up. So I started recording myself with a heart monitor to show like how my heartbeat would jump up 50 beats a minute when I was just sitting on the ground to standing. I was exhausted, like physically exhausted, weakness, like muscle weakness. Like there were times where like even holding a coffee cup hurt my arms. Things were subluxing all the time for no reason. I couldn't figure it out. Like randomly, things would just pop out of place. And I didn't know at the time that that's what was happening, because I knew like my knees were hypermobile. I wasn't fully aware that everything else was. The exhaustion, the brain fog, which is why they kept saying like, "Oh, it's fibro fog." And I'm like, I don't know if that's true, but I guess like I just couldn't think. My cognitive abilities was gone. Like I have done graphic design since my early 20s, and I've used the same programs since that time. And I would be trying to design something and my mind would go blank, and I couldn't remember the keyboard shortcuts that I could do in my sleep. And I suddenly just sat there and I couldn't think. It was just a lot of little things that I kept noticing over and over. And I'm like, nobody's paying attention to this. Like, it's not normal that my joints, like I'm swelling and I've got like this lump under my skin with no injury. Like that was the most frustrating thing, because I'm very logical. I'm like, I haven't done anything. I'm just sitting here and all of a sudden I can't close my hand and it's swollen. Like there's got to be something behind this. And fibromyalgia does not make sense to me as far as like the cause of all of these physical symptoms.
So now that you know what's going on a little bit better, do you have like a team in place or a protocol at home or things that help you cope better?
Yes, it's getting better. I have my primary care doctor is very open to learning, and
That's
to the point where he admitted to me like, I don't know very much about this. I'm going to listen to you. He's like, I defer to you. So what I've typically been doing is like with research,
Can you
I will
use
go in
those
with research
words?
papers. Yes. Yes, he did.
Wow. Oh my God.
So to the point where now, like, I have, he's a wonderful doctor. Like, I appreciate that he actually listens to me and is never like at one point, yes, I was very anxious, but I'm like, wouldn't you be anxious if like you feel like you're dying and nobody's listening to you? Like, kind of. But he was the one, like he did like the gene site test, because I kept saying, I was like, medicines are weird. Like medicines don't work on me the same way they work on everybody else. And these antidepressants that you're giving me aren't doing anything.
Yeah.
So when I more with the EDS research, he was absolutely very supportive. And whenever I would suggest a medication or a treatment, he'd be like, absolutely. I'll look into it. Like if it's a medication and he wasn't, especially if it's off-label use,
Yeah.
he would get back to me. He was like, I'm going to look into this as it pertains to you with this situation because it's off-label, but I will do this. And he's been very supportive. As far as like me using mobility aids, he offered me a handicap placard because he was like, how do you walk into stores? Because I'm like, I wait until somebody leaves a shopping cart close enough where I can use it. And then I go in. He's like, that's ridiculous. I'll just give you a parking pass. Like, you need these things. It's okay to use them. He also uncovered, I was diagnosed with ADHD last year. And that was out of the blue completely. He picked that up because I've been going to him for a while and I was complaining about like the fibro fog and like, I'm like, I can't function anymore. And I don't understand why, because I've always functioned very well, even under high stress. Like I'm very good at just keep going, keep going, keep going. I can't anymore. And he was like, when were you diagnosed with ADHD? I was like, I'm not. He goes, never? I was like, no. He goes, interesting. How about we take this little assessment? I'm like, I don't have ADHD. Like my stepson, I learned it because my stepson was diagnosed when he was young. And trying to be a really good stepmom, I'm like, I'm going to support you and I'm going to learn about this because I don't know about it.
Right.
But I also didn't know that it's different in young boys and young
Yep.
girls and how it presents differently. So I took the assessment in his office and like 10 minutes, he was doing notes and I was taking the assessment. And like 10 minutes later, he's like, so how are we doing? I'm like, question. He goes, what? I'm like, I'm on number 1. He's like, you haven't done it yet? I'm like, I'm stuck. So here's the thing.
So you're diagnosed.
This, but technically,
like you don't even
I'm
need to give me the paper.
diagnosed. Yeah. It's exactly what he said. He was like, honestly, he was like, I think there's a little bit more going on here than just ADHD, but we're just going to focus on this right now. Okay. And he was really nice about it and very like
shocked.
patient with me. Yeah, he's really good.
How old is he?
It's been good.
Okay.
That has.
Did you just ask how old he was?
Yes.
Okay, because that's exactly what I was going to say.
When he would have gone to medical school. Yeah.
I don't know because I'm really bad and I have this thing where I feel very young to other people. Like
What
I
does
think
he
I'm
look
the same
like?
age as my kid's teacher. He's young. He's probably like 45,
Okay.
50.
Okay.
He's not, yeah, he's about our age.
He's not crusty, like old. Okay.
So
He's been good. And then honestly, lately I lead off because a lot of the new specialists that I have, because of the EDS, like I have different specialists now. Either my doctors have left and I had to get new ones, but I will bring my binder with me and explain like I'm not crazy or neurotic. Like please don't think I'm a hypochondriac. I have this, and then I also bring printouts. So I ask the doctor if they're familiar with EDS, and depending on what they say, I kind of look at it like a first date. So like the rheumatologist that diagnosed me with fibromyalgia, once I found out about the EDS, I had a follow-up a year later. And I was so excited because I'm going to walk in there and be like, I told you. She
They
still
don't
said
like
it was fibromyalgia. And she's like, no, well, I didn't go in. I'm sorry. In my head, I'm like,
Oh,
what?
I did
But I
that
walked
once.
in there, I'm like,
They don't like that.
hey. No, I know how to like read the room and I'm like, so I heard about this thing and my doctor says that I meet the criteria. And I was kind of wondering what you thought about it because, you know, it even says in this pamphlet medical journal, I've highlighted here for your convenience, that EDS is often misdiagnosed as fibromyalgia initially. What are your thoughts? And she was like, well, yeah, but all that means is that you're bendy. Like it just means you're flexible. It's benign. And then in my notes, she put down that, EDS, but she's like benign. And I was absolutely livid. Like I had a meltdown when I got home and I read the notes on that. And I was like, oh, okay.
You're really glad I never went and really read the notes early on.
since fighting words, right?
I had to because what they were telling me wasn't what they were writing down. So
Yeah.
I realized like I have to like
Make it
look
loud.
into my own like care.
So you've become a good advocate in like when you meet a provider, that sort of thing. You know, we get really frustrated when they discount us or don't listen or just recommend like lifestyle changes. But a lot of times that's all like we're
Mhm.
left with. What have you done like at home outside of like the medical world that has helped you cope? Like, what are those hypermobility hacks that work for Tiffany?
I think the biggest, first and foremost, is finding support, like finding your people that get it. Because at least for me, a lot of the things like I've noticed my symptoms definitely have, they ebb and flow, and stress definitely attributes to having more bad days than good. Listening to other zebras, like initially, like what they were doing and picking up, learning to listen to myself and actually introspectively thinking and realize how much I'm doing without realizing I'm doing, bracing, like supports, and not. I've had a lot of doctors like, you don't need supports. It's just going to lead to like your muscles atrophy. Like, it's not what you need. But then again, I've had other doctors like my podiatrist who was amazing. And right off the bat, he was just like, let's see your feet. Because I joked that I had a sixth toe growing because my joint would sublux so much that I've got like things. So I drew a little toenail on it with a happy face to make joke of it. And I think that like got him like, I was like, I need help because it hurts to walk a lot. He was like, well, first the PA, the assistant students came in and I had told them, I'm like, hi, I have Ehlers-Danlos syndrome. Is doctor, familiar? And they're like, you do? And I'm like, yes. And they're like, oh. And I'm like, what? And they're like, we've heard about this, but we've never seen it. I'm like, gather around. I'm like, come. And they're like, so they're doing the exam and she's like, look at this. She's like, I'm subluxing it right now. She goes, does it hurt? I'm like, no, it doesn't hurt. But thank you for asking. But I was like, I've done that so many times now, it doesn't hurt anymore. Like, so I love that because I'm like, if you guys need a model, like, feel free. Like, you want the hands too, whatever it is, just to get you not, because they were so excited. And I'm like, these are the doctors that my kids are going to see.
Were you like, here, touch my skin so you know it feels different? Yeah.
Right. Yeah.
I did. I was just like showing, like they were asking about things. I didn't know about the skin thing. I used to work at a place called Lush that does like handmade products. And I was like pimped out to sell products because my skin was really soft anyway. So I would do like demonstrations with like ocean salt. Granted, it's awesome anyway. But then they were like I remember my manager grabbing my arm and holding it out to a lady, like touch her, and then they'd be like, "Oh my God!" I'm like, "Yay!" Like I didn't
You
know
were a
that
marketing
was a
gimmick.
thing.
Well, that's what annoys me about some of these
Yeah.
like infomercials you see with people who clearly have like a connective tissue disorder, and that's why they look so young and they're hawking
Mhm.
their products to people. And I'm like, no, like not everybody can look like that. And that makes me so sad.
I have an idea. Let's make a wrinkle cream and use like our parents and then us as like, you know, I mean, my mom who looks
I think that
40,
would be
we
good.
could make bank. Yeah.
My
How
mom
else?
was always like, I would hear people tell her, like, you look like your house. Also, my mom's undiagnosed, by the way.
Same.
But now we're learning about things, and I'm like, you're exactly like me. But people would tell her, like, how old are you? Like, are you sure? Like, and when you're a kid, everybody looks older. So to me, I didn't get that. I'm like, she looks old. She's my mom. Like I didn't understand. But now looking at pictures, yeah.
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 So you talked about, outside of healthcare, things that helped, and one of them was support. How does that
Mm.
work for you? Where did you seek that out?
Emotional or physical? Which one are we talking?
All of the above.
Emotional would be probably, honestly, TikTok, which I'm late to the TikTok party because I didn't get on it until I think last year, only
Wait,
because like
there's
my
a
two
party?
friends. Yes, TikTok is the whole party. All the
I
time.
just thought it was rude.
Because they're dancing. It was like the dance thing. So I was like, I am too old for TikTok. But then like my one friend who came to visit was like showing me about it, and they had just gotten on it like a few months before, and I was like, all right, fine. And plus I'm like, I probably should because I do like graphic design and I'm in the marketing world-ish. So I should keep on top of trends. That was a big trend. So I kind of went with it. But just hearing, honestly, a lot of it is hearing. What? What? I
I'm
don't
so sorry
know.
I
I don't know what that.
derailed. You were both like doing this at the same time. I died. Okay, anyhow, go ahead.
I was so into moving
Sorry.
around, I didn't even notice.
She was.
Sorry.
Both were.
I didn't
Oh, we're
either.
both. Oh,
It was cute.
okay.
Yeah. I don't even notice
Outtakes.
anymore. I'm
Sorry.
just constantly like, and yeah. But even not reaching out and talking to people, but just hearing other people was extremely validating for me, especially having gone like a year and a half ish, 2 years, being told that it's in my head essentially. So in that weird like lurker kind of way, I'm not super active on social media just because I don't know. It doesn't register to me to do things. I mean to, and I just don't. But just hearing other people's stories has been like super helpful. And even though it's a one-way kind of support, it's also like when you can comment and back and forth. I mean, it's not like talking face to face or virtual with somebody. I'm very rural, so finding quality healthcare of people that know it's very hard to find, but also finding other people in the I know we're out here somewhere. I'm just trying to do my best to like find the local people. But even then, until that, it's been a lot of like virtual, like reaching out to you ladies and just being like, thank you. Because it truly like meant so much to hear, especially hearing from other moms. Because at the time I was like realizing things about my own kids too. It helped just hearing somebody else like a lot of things you guys were saying was like verbatim. I was like, that's me, like same. So it was nice. I
So the
appreciated
bar
it.
is
And then
so low that validation is up there with support.
right. It is, isn't
And
that like I know that sounds
and that
awful, but
two
like
other
that was like
late diagnosed people in their 40s, they met on TikTok randomly and decided to make a podcast
On a whim without any experience.
Yeah, and then to come across you and look and anyway, that's just
I appreciate it. And I don't know if it's whatever kind of algorithm magic they got going on.
You mentioned the support as a mom going through this. Can you talk to me about how you try to support your kiddos?
Oh, that's a hard one for me. So I'm still fighting for a lot of stuff for the girls. I feel like the more I learn about myself and the more I'm able to look at them, they're both neurodivergent AF. Like and it's funny because I have a thing. I'm going through a little bit of a difficult time as far as like other family members with diagnosing and accepting things and thinking of them as a bad thing. So
We have a term for that.
What is
It's called
it?
internalized ableism.
There we go. Yeah.
internalized ableism.
So when I was diagnosed with ADHD, I called my sister, who is exactly like me. And I was like, dude, guess what?
Is she older or younger?
She's younger by 2 years.
Okay.
So I sent her a link for like the assessment that my doctor had me do. And she kind of brushed it off. Like she laughed, like jokingly, like, haha, kind of as sisters do. And then a month later, she called me back and she was like, what the F? I was like, what? And she goes, I just left my doctor's office. I'm like, okay, what's going on? She goes, yeah, I got the ADHD too. And
Yeah, it's highly heritable.
my life is, yeah. Yeah. But it's just crazy because I'm like now seeing things and I'm like, oh, because you only know yourself, so
Right.
you
So
always
she
think it's
was
like
she
this is
devastated?
normal.
So,
No, she didn't take it nearly as hard as I did.
so you were devastated.
I was.
Interesting.
I was, that. So that was last year. That was the end of July last year. And it was like this downward spiral from there. And I think it was a combination of like the physical feelings and being so sick for so long. And then with that diagnosis, when I started looking into, because I left the doctor's office like, haha, yeah, right. And he was like, well, you know what? Do your research, come back, we'll talk about it. And I'm like, absolutely. So then I get home, I mentioned it to my husband, and he was like, oh, yeah. I was like, wait, what? And he was like,
Spoiler
yeah,
alert.
babe. He's like, I was wondering. So then I start looking into it, and it was like an implosion in my brain, honestly, like realizing all the things like from little, like,
Yeah.
Was
and
it
then
because
in
you
that
were
same token, like,
processing all of the things that now made sense?
yeah, it was a lot of like looking back and realizing so many things that I was hurting over that I should never have been and blaming
Mm.
myself. And I was always very much like a perfectionist kid. I have done like the rads and all that kind of fun stuff. So I'm believing there's a little sprinkle of autism in there as well. I'm not going to probably pursue a formal diagnosis because I don't have the thousands of dollars.
There's no need to.
Um, I don't have the mental energy, honestly, for that right now because I've got my kids. But yeah, it was a lot of like processing and realizing things that weren't normal for everybody. Like I used to wake up when I went to a private Catholic elementary school, and once I hit like sixth grade, I was struggling and I could not do my homework. And I wanted to because my goal was to get into the National Junior Honor Society because being like the smart kid has always been very important to me. And that was my
Is that
goal.
because of
And I
praise
remember
from
I would,
parents? Smart
yes.
kids got praised and
Mhm.
rewarded, and you're so smart.
Oh,
Look at how
yeah,
smart Tiffany
absolutely.
is. Yeah.
She's gifted.
Mm-hmm.
So, but yeah,
Yeah.
I would wake up at 4 or 5 in the morning. I would set my alarm. So I had that stress of you need to do your homework now. School starts in 2 hours, like kind of thing. So then I would do my homework and then I would go back to bed for like half an hour. Everything I did was last minute. I wrote, even in college, like unknowingly, like I would write thesis papers like the day before they were due. And I remember my English professor, my freshman year of college, was like, pulled me aside and was like, you need to be a writer because this is incredible. And I can tell the care and the hard work that you put into it. And I'm like, oh, no, 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 I didn't do, because I would feel guilty because I'm like, no, I just wrote that. Like, but
And
she
if
was,
you had
she didn't
said
believe
that, they
me. And
wouldn't have believed you anyway.
she didn't.
So
I was
this
like,
is
no, I just wrote that.
very
Like,
familiar to all of us. Yes, just checking in. Yeah,
Yeah.
okay.
yeah, yeah, didn't know. Um, but because of that, I see things in my kids now.
Mhm.
And I have always like, so my first daughter was born with bilateral clubfoot out of the blue. Like no family on either side. We have no history. Now we know. But that was like shattering to me because I didn't know anything about it. I obviously you've seen people, but I didn't know anything about it. And they found it at the anatomy scan. So I was 18 weeks pregnant. And she's doing all the stuff and she's like, it's a girl. And it was my first pregnancy. And I was like, oh my God. And then she goes down, she goes, and her face changes. And I'm like, what's going on? Because I could read people. You know, I'm very like, I see something.
Mhm.
And I'm like, what's going on? And she's like, you didn't do anything wrong. And everything's okay. And I'm like, what do you mean I didn't do anything wrong? I'm like, what do you mean? And then she's like, so I'm going to call the doctor because it looks like she has a little bit of a foot thing going on. I'm like, okay, cool. So the doctor comes in, confirms, he's like, she's got clubfoot. And in my head, I'm like, well, she's never going to walk. Like in my head, that's what it immediately went to because you
Yeah, like
see.
what does that mean? Did they explain it?
No, they essentially said like it's her feet are twisted in and that they referred me to a pediatric orthopedic specialist. I had a prenatal appointment with him. He explained that all you have to do is you cast for X amount of weeks. They do a little surgery on the tendon, and then you put them in another cast for a couple more weeks, and then they wear braces for
Weird.
about 4 years, and everything's fine. So I'm like, okay, I guess that's what it is. It's
But they
not
didn't
fine.
mention other issues.
No.
Like they acted like that was a standalone, like oopsie, like that nothing else might be.
The only thing they did was offer genetic testing. But the only thing the genetic test would prove would be, what was it? There was like a standard panel. I believe it tested for like Down syndrome. Um,
The
can't think
triple
of the word right
screen.
now.
Trisomy.
Yeah. And I was like, is
Or
anything that we're going to learn from this test going to have an effect on her care? Because unless it means that we can find something sooner and there's something that needs to be done like in utero, then nothing you're going to say is going to matter. And it wouldn't have tested for EDS anyway. Because
yeah.
I kicked myself for a while initially because I was like, you should have done that. And I'm like, but they wouldn't have tested for it. So how would I have known, you know?
Yeah.
Um, yeah, I still didn't pick it up until very recently about her clubfoot being possibly connected. That's new. And then she also, like, I didn't realize she was hypermobile until we went to UVA for her clubfoot treatment,
Wahoo!
fourth
Sorry.
go around, because she has relapsed 4 times at that point, despite us doing everything. Like I used to sew her braces on her feet. Like I would sew the buckles closed and then I would get zip ties because she figured out how to get out of them. And now we know she was hypermobile back then, so she could remove everything. Um, like I was so adamant because I'm like, I am so sorry that in my head I was like, this is my fault, you know, my genes, you know. I'm gonna do what I can to make it as best for you as I can. So I did all the research on everything clubfoot related. She also has metatarsus adductus, which I also have, which I just found out a few months ago. But we didn't know a lot of the stuff until we went to UVA, and they were like, she saw a PA for the clubfoot the first go around treatment there, and she's like, I'm gonna do some flexibility screenings on her because she's flexible. Like just looking at her, they knew. And then she was like, look at this hip, Cirque du Soleil. And I was like, oh, is that not? She's like, no, they shouldn't be able to do this. But I'm like, mine did.
But
Like,
I can do that.
yeah, we didn't know. And even she said like she had made a comment, like she's like typically like she's like, you look very flexible too. She's like, you're standing. She's like, you're already like your posture and just how you're standing, I can see that you're also. But there was just a lot of stuff like we didn't know until I started putting all the little things together. And then within the last year, doing more research into EDS. And I'm like, she could very well have a different subtype rather than just hypermobile. Right now, she's diagnosed hypermobile. And she does have obviously with the clubfoot. I'm pushing for her to get genetic testing through insurance because she's a kid with all of these other issues that are not responding to treatment.
Mhm.
And her last orthopedic, we just saw, she just broke her foot. So that was fun. And then we had to go to get that looked at. And while we were there, I had mentioned I'm starting to wonder if there's also not something neurological going on, because in doing the research with EDS and clubfoot and now looking at like, I'm going to butcher the name of this, Charcot-Marie-Tooth,
Mhm.
CMT.
Yeah.
In a couple of the clubfoot support groups that I'm in for like parents of clubfoot, a couple of people have been mentioning, or I've seen them, like, my super resistant to treat child, we just did tests. Turns out they've got, there's something neurological going on because her feet are very flexible. So it's not that they're rigid, and she had a surgery to correct it. Yeah.
So
So
you have an odd definition of fun. But Shelly, don't you also have the CMT genes too?
Yeah.
We both do.
And my sister was born with hip dysplasia
And
wore a brace and all of that.
yeah, and both me and Evelyn have severe hip dysplasia from birth.
they never said she had hip dysplasia. They just, like, her doctor, when he was doing the treatment, like, would do it and be like, oh, shouldn't do that. Like,
because we can still walk. Yeah. So if you could go back in time, what advice would you give your family or yourself?
oh, so much. I honestly don't know. Am I going back in time with the knowledge? Is the knowledge that we've now learned available back then?
What would you do more
because
proactively?
Yeah. I would have told my dance teachers to stop making me do stuff for party tricks and like highlighting and exploiting things. Like, I wish I had more ability to stand up for myself and advocate for myself younger. I didn't get my advocacy boost until my kids, honestly. Like, when I had my first daughter, like, that's when I started, like, something changed, and I was able to be like, no, you're going to do this because this is what the research says. And, can you show me your rationale? Or the daycare I had her in had taken her out of her braces more than once, and I went off. And I'm a very Pisces, like, meek, quiet, like, don't want to cause problems. And I was just going off on them. At the very least, tell myself not to be so hard on myself. Because I think that was a lot of the problems, is like, why can't I run like the other kids without fall? I would fall all the time because my
God, I
things would
would
just pop
double
out of
over
place.
with
Like, I
a
wanted to
stiff.
run.
I would hide it so much. Yeah,
Yep.
I know.
Yeah.
I remember 8th grade,
I could
my last
speed
year
walk
at the
faster than
school,
I could
and
run.
I practiced. And I didn't know it then with the POTS thing. Also, like, exercise intolerance, didn't know. So we had like this 440 relay run, and I always hated it because I know I can't run long distances without falling. And you would get your name called or picked on a team, and you would hear your teammates go, "Ugh." So, and these are kids like you grow up with, because mostly everybody, year after year, it's the same kids. So 8th grade, I was like, I'm going out. I'm going to do it. And I got all the way to the like almost to the finish line. And I was like, it's happening. I'm doing it. And I ended up subluxing my knee, tumbleweeded towards the finish line it was awful. And then I was so dizzy and sick that I was on like the side, like with the water and everything. And I was like, I couldn't stand up. I was so dizzy. And I remember the teachers were like, you're very out of shape. And I'd been training for that 440 run. Like, I've been running around my grandmother's house, like, pretending that I was doing it. So I think a lot of that, I would just tell myself not to be so hard.
3 hours. There were days I couldn't finish a soccer game. I get it. Like, we're conundrums, right? And because we pushed ourselves so hard, you sounds like you were actually really, really athletic and in shape at the time. Yeah.
I got made fun of because I had man legs.
So did you win the race?
We did. I ended up finishing. My group of people that I was with were the best runners, and luckily, because of them being so awesome, counteracted my not being awesome, and we still won. But I was made to like definitely reminded that it was because of them that we won. So yeah.
I think we've finished the race. You answered a lot
There's
of
no I
questions.
in team.
Shelley,
Yeah.
What? What's up?
what did you want to ask?
Oh, shit. Um,
AMA.
Don't give her that latitude.
I've gotten a lot more open the older I get because I'm like, I'm going to tell everybody everything because, you know, it helps people
I
not feel so
You know who
alone.
you're
And
talking to, right?
yeah, every time I tell everybody like I'm open about some new thing, people are like, "Oh, holy shit." I'm like, "That's why I am like I'm sure some people are like, "Oh my god, she's still talking about blah 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 blah." Well, yeah, because apparently people still don't know about it or enough about it or
And oversharing is apparently how we cope. Shelley is the president. I am the vice president.
yes. Let me see
I
what do I
think
want
it's
to
kind of a way of like rebelling against Catholic school. Don't say anything. Like we don't talk about that. And I think that's just my way. I don't know.
Were you raised Catholic too?
Yes.
Yeah, how long so were you in Catholic school all the way through graduation? Like high school?
No, only till 8th grade.
Okay.
And then after 8th grade, I went to, there was talk of me going to another private Catholic school or another private school. And I just did not want to do that. I
Yeah.
did not fit in. I got in trouble for asking too many questions in Catholic school. Like the year that our archdiocese let girls be altar servers, I jumped on it only because I was like, look at me up on the altar where I'm not supposed to be because I'm a girl. It was that thing. It wasn't because I was like, it wasn't a faith thing. It was because I'm like, I'm going to show you. And I just remember getting in so much trouble for, and it wasn't to be like a smart ass. Like it was a genuine, like, I don't
You wanted the
understand because this
information.
doesn't make sense to me. Yeah. But it was looked at as,
Being a troublemaker,
I
combative,
can't,
or why are
yeah.
you? But then, like, did you have an active social life? Like, how did that work out for you in high school? Like, did you
I
feel
did, but it was with very select people
Mhm.
who I'm still friends with today, who is
Okay?
like my still best friends.
Oh, are they the ones that came to just
Um,
visit recently?
yeah,
Awesome. Love it.
yeah. So all throughout high school, my best friend's actually a year behind me, and then his wife, who ironically I hated in high school because she was gorgeous and smart, and she was very like she was the opposite of me in that like I was always overly friendly. It's like a coping mechanism. Like I never stayed like, but she was very much like if
Guarded.
she didn't like you, she didn't like you. And that,
Yeah.
yeah. So I really wasn't like a fan of hers until they got together and she had invited me for his birthday party because I stopped essentially like I distanced myself for a while. We also
Yeah.
dated for like 9 months because I'm like, okay, well, you're supposed to date people and I love him. So I guess we're supposed to date because we get along
Yeah.
so
That's the
well, and I
formula,
love him.
right? That's what I learned on
I
TV.
dated most of like friends because that's what I like figured you were supposed to do because I didn't know that like there's different levels, like you can absolutely love somebody with your whole heart, but not be in love in the romantic sense. So we
Yeah.
broke up
Wouldn't that
and then I stopped
information have been
talking to him
helpful
for a little
like
bit.
back then?
Really would have. So you didn't get mislabeled as like the Ash that dated all
Mhm.
the guys that were her friends.
Mhm.
And also because like you weren't supposed to date girls because you were Catholic. So you're just like, I guess it's this is my option, right? Yeah. Lots of things like as an adult,
So
I'm like,
many.
Oh.
layers.
But yeah, it's weird. Like they're absolutely like both of them are my best friends and they're also neurodivergent. And when I mentioned things to them, they were diagnosed way earlier. And I remember calling him, I was like, Panda, you will not believe this. And he was like, yeah. I was like, wait, what? And I was like, and the doctor said he thinks there's a little more. Like, like maybe I'm on the spectrum. And we had a friend, a mutual friend that was diagnosed ASD, but with the old name, because
Mhm.
that's what it was back then. And he was like, do you remember what happened when so-and-so was diagnosed? And I was like, well, he's like, do you remember you got your stuffed animal? And like you would go up and like you did puppet shows for him. Like, I still think you're cool. And like, because he was like, like, what? And I was like, yeah. He's like, that's not normal. He's like, that's you. He's like, we love you. Don't, it's nothing bad. It's just, he's like, you're the most interesting person I've ever met. And he's like, it's a compliment. He's like, but you're not like most people. He's like, which is why we're friends because I find you interesting. And I was like, oh, thank you.
I mean, that's pretty awesome. It's also a clue, but that's awesome. But
It is.
that's
There's a lot of clues.
you don't know,
You go
especially when
backwards
you're
and cross.
surrounded by it and your family is like that. Like everybody's like this,
Well,
right? Right? Right?
yeah, like it's funny because like especially like if I look at like my group of friends, like we were all like the eccentric kids. Many of us, like many of my friends had already been diagnosed with ADHD and or autism, like and it wasn't anything different for me. Like that again should have been like a big clue, but it just didn't strike me as anything like I don't get what the big deal
Like
is. Like I
right.
miscommunications, misreading, like so many issues and misinterpretations of things, which is like something like my husband and I are still like working with because now that these things are coming to light and I'm like so much of our we don't really fight, but so much of our like hurt feelings and things are just misinterpretations of things because I have what was called RBF.
I
Um now I
wonder what that is.
I don't yeah, what is this called?
RBF.
R
Look at my face.
R R it's resting bitch. Like something that looks like this maybe.
Rest image brain.
Yeah.
We
Like
got
I
it.
have heard from so many people that I look pissed off, angry. I've had a couple coworkers, like, because especially like when I'm working, I'm focused. I'm focused. I don't pay attention to what my face does. And I've had so many coworkers, like, after the fact, be like, you are the nicest person, but you're
I thought
scary
you
as
hated
shit. Like,
me.
I was so scared. Yeah.
Do you manage emotionally with the burnout and the trying to manage all the things that you really don't get a choice in managing as a zebra mom?
I don't quite know yet, honestly. If I'm being completely
Working on
honest.
it.
I'm still trying to figure it out. I do go to therapy. I'm thinking I need to have a separation with my therapist. We've been seeing each other for about 3 years.
So like talk
Um,
therapy.
yes. And a lot of it is like I had a little bit of a breakdown in February when just everything that was like max burnout for me. I remember we were having a session and I'm going to cross stitch this for her. Her favorite thing to say is boundaries. And I was like, clearly, I don't understand what you mean. It's been 2.5 years at that point. I don't know how to set boundaries that are appropriate. I don't know what that means. And she's also like with Amelia and her getting upset, like a lot of times, like now knowing it in a different view and understanding what's going on, a lot of it was I'm like, this isn't typical. Like she just started sleeping through the night 6, 7 months ago. Like this is what that's from. Like she didn't sleep through the night. She would come wake me up. I'd have to go hold her and get her back to bed. With her having, when she's overwhelmed, me
Does
being the
she have a
comfort
weighted
bearer, and I was
blanket?
telling, she didn't like them. I know. I
What
know.
about you seeing those things that like snug you in?
The sleep sack thingy.
Yeah.
We did the sleep snack. I keep saying snack sack. Sleep sack. We did the weighted loveys, like the ones that have like the soothers, the ones that like vibrate. I think a lot of it too, she has night terrors, which I also had, and she sleepwalks, which I also do. So she doesn't like a lot of times even know that she's coming to get me. She has no recollection.
Do
So
you know what that's
it's kind of hard
comorbid
to
with?
what?
Connective tissue disorders.
Shut the front door.
No.
Is it really?
Yes.
Both of us are just like,
Right? Did you see our faces? We're like, yeah.
No, I saw them.
nothing is unique with us.
It's just, you know what? It's funny because it's like everything to the point where it's almost like a joke in my head. I'm just like, oh, that's the EDS. But I had like horrific, and I still like vividly remember a lot of them. But my mom was scared of me at one point when I was like 4 or 5 because I would physically hurt myself. Like at one point, like she was telling me I would walk out and start smashing my head in the wall. There was one other time where she was like, I was petrified. Mind you, this is right after like Exorcist and things like that a few years before. And she's like, you were screaming. I came into your room and you were sitting up against the wall in the corner, biting your knee so hard that you were bleeding. Like you were drawing blood from biting your own knee and screaming. And she goes, it was absolutely petrifying. I'm like, I
Do
don't
you
remember that.
reenact your
She goes,
dreams in your
yeah.
sleep?
Apparently, yeah.
Okay.
So my daughter had waking things that were very scary, but I recognized it as very familiar because she was saying things out loud that as a child I was too scared to say aloud. You know, I think some of those dreams are enacting fears or whatever. She was 7 when she first said, I just wish I was dead. And the people outside of me around us, like her father, interpreted that as like, you know, an active wish to take her life. And I was like, no, it's she wishes she was not experiencing life. And I picture you eating your knee, thinking, I wish I could just bite off my knee because it hurts.
Like a wounded animal is what I finally like realized what it was. It's because it was my left knee, which is the one that I had the surgery on.
Yeah.
And the same with her. Like Amelia I remember one night, she's very like sensitive skin issue. And I remember she was 5 and she was scratching and itching and she didn't have a bug bite or anything. She was just, something was just getting to her, like overstimulating that one spot. And I remember she was crying and scratching so hard. And she's like little, like she's a very petite, little tiny thing. And she was like, I just want to rip my skin off. And that blew me away because she's little. Like, how do you
A
put
normal
that
child
together? You know, like,
because they wouldn't have a reason to comprehend that level of pain.
yeah.
Yeah.
It's hard for me because she's very hypersensitive to pain. So even like stubbing your toe is like earth shattering. And then when we did the gene site test, we found that we're both the carriers for the MET gene thing. I forget which one it is. So we're hypersensitive to pain.
Mhm.
So we
Everyone
perceive pain.
diagnosed with the pain disorder where you overly process pain and we've done physical and occupational therapies for it. So if you want to talk offline, I've got some ideas.
Absolutely, because we're in occupation, and I've told them like that's one of the things we need to work on. I'm like, as much as like even this morning, like her throat hurts because she's got allergies and she's been coughing, and she's cried so many times because her throat's killing her. I'm like, I know it's very frustrating, and I'm trying to be empathetic, and I'm like, how do you tell an 8-year-old that they're going to be in pain most of their life forever? It's something's usually always going to hurt. I don't want to tell her that but I also don't want it to be a
You don't
lot
want
of
to
my
sugar, you don't want to
things
lie.
was,
You want to
and
be
that's the
realistic.
thing, like a lot of my things, I'm much more of a realistic person. So had the like even with Avery with her feet, if they had been like, there's a chance she could relapse, there's a chance. I was told you do this, she'll be okay. And remember, I'm very literal. So I'm like, okay, cool. We'll do this. She'll be okay. So when she kept relapsing, that was so hard for me because I'm like, I wish somebody just told me the truth. Like, yes, typically they're fine. However, this could happen just so I knew because I was expecting this because this is what I
Right.
was told. And I would just like to be better mentally prepared for things.
So other parents are concerned with telling their kids there's no Santa and that elf on the shelf isn't really moving on their own. And we're worried about at what age do I tell my kid that
You're in for a lifetime of pain.
Yeah.
my belief
That's
through this with my child is to be honest so that they can start on working on accepting and sitting in the discomfort and, clocking it down like that mental game we play. Because otherwise, I think I let it go on too long with Evie. And that's how she spiraled into pain disorder. And now she has so much
that's
like
what
body.
I'm worried about.
Yeah.
Just like with Avery's feet, I don't know what the answer is as far as like if it will ever be okay. I don't know. And I think with me, I'm extremely empathetic. And like, what else did she oh, synesthesia. I have synesthesia. Just figured that out. Like we never knew. And I'm like amazed by it. Like when I figured it out and I remember talking to my parents, I was like, "Hey, do you guys feel music?" And they're like, "What?" And I'm like, "Do you guys feel music like
There's not.
in your body?" And I'm trying to explain it to them and they're like, "What?"
I
No.
do.
Yeah, and
We do.
I was
And
like,
we've like stemmed it together intentionally.
What?
You and I
it
like have intentionally created those experiences to stem Frazan with music together.
Mm-hmm.
it's just it to me it was like an amazing because it made sense. Like I'm like, that's why nobody understood her. I'm like, wow, this feels like fireworks. Or, I'm
Mm-hmm.
like, oh, this is very floaty because I would feel like my body was lifting in the air and nobody was like, what are you talking about? But I'm like, it's to me, it's just good things. And it also it kills me to think of how I see a lot of like what she's been through. And this is what when we were talking about like the medical trauma and things, and I'm like, you don't understand where this is. I'm doing this because she was saying how it was affecting my girls because I was so worked up and I was so angry about it. And I'm like, because and she's like, I coughed and your girls were like, oh my God, are you okay? She's like, they think you're dying. I'm like, because I felt like I was dying. And I don't know how to tell you this. I felt the same way when I was their age with you because you were going through all of these same health issues that nobody would listen to you. And I see myself in you and I see how things have progressed for you. And I refuse to let that continue on for yet another generation because I was saying about like how bad my neck hurt. She goes, oh, I've got a neck brace. I was about your age when my neck started hurting. And I was like, in my lower back. And she goes, oh, I have a back brace too. I'm supposed to wear, but I could never wear it because the neck brace, I don't like things touching my neck. And I had, I know exactly. But I'm like, these are key things to tell me. But it's exactly that. And I'm like, I won't let that happen to them. As much as I can prevent it, I need to stop it because I also know that this happened with my grandmother. And I'm tired of seeing woman after woman after woman in my family go through the same thing and not getting help. And I refuse to just shut up and take it. I'm so angry about that. I refuse because I see the quality of life that my mother has and it breaks my heart. I see and hearing all her years of trauma about so many different things. And that just breaks my heart to know that that's what she's lived through. That's what she's been trained to think a certain way. And I'm like, I know I can't change that. And the only thing I can do is be okay with myself and show her that, yes, there is some things that are wrong with me, but wrong doesn't equate to bad. And it's just something that I have to learn how to work around and work because it's a part of my life. I have to learn how to do things incorporating these other things. And it's not bad. It's just different. I don't know if I'm ever going to change that mindset, and I can't. It's not my job.
No.
But I'm hoping like the lead by example, like
It so yes.
I'm really proud of you.
Me
That
too.
can't be easy. I am. I'm proud of you.
thank you.
So we always seem to end up talking about the generational trauma of the undiagnosed zebra experience, the inherited connective tissue disorders, whether it's changing over the generations or really it's just been ignored. I don't know, but in my family, to validate your experience, I've seen my parents progress and what they struggle with. My mom has had 2 spinal fusions. My dad's having one shortly. And I see them
My mom just had her knee replaced.
with such intense internalized ableism that they've faced because of our diagnosis. And it really started with the child in our family who was the sickest of all of us, who I also reacted like you do as an angry mama bear.
Mm-hmm.
That's what propelled the change. And I mean, it's been a few years for us though. And now I see them undoing some things. It's not perfect. They're still boomers, but we can still have grace with them, but prioritize us and our kids. Thank you for sharing all of that though, by the way. I know it was not easy to get it all out.
Thank you. It just came out. I'm sorry about that.
Mm-hmm.
I think that's honestly been like the biggest like force, I guess I can say. I don't even know what it is. I'm just like absolutely compelled to be that annoying person that has to educate everybody. Because in my head, I'm like, more than likely, you probably know somebody and don't even know it. And the more that I talk about random things like with people or, just anything, especially like with Avery, like Avery does not necessarily want to be like the poster child for Clubfoot at her school,
Yeah.
which I understand and I appreciate. And I would never like,
It's okay.
absolutely, absolutely at that age. Yeah. But that doesn't mean that I can't tell the school administrators like, hey, can we sit down and have a little meeting so I can discuss what EDS is? Because you're going to come across it. And
Yeah, it's
I
not going
think if you're
away.
more aware of it, no. And I'm like, I can guarantee you've probably had many kids with at least hypermobility spectrum that we can help if
I
you
fully
pick
support
up on
that
it.
in the structured plans meetings, the 504s, but also beyond that. Like I talked to coaches and educated them on both dysautonomia and hypermobility disorders, and they were actually really receptive. Not
Yeah.
been lucky. So go for it. Be your voice.
I'm
Scared to ask.
fiercely independent and I never ask anybody for anything. Like
Yeah, me too.
I just do it
Yeah.
myself.
Fair.
So I got to work on that.
I'm working on that too. So we can learn how to
I feel like life has forced me to work on that.
say, yeah.
Mm-hmm.
If I don't want to be miserable in my own body, I have to accept that I need to ask for and accept help.
Yes, ma'am.
Mm-hmm.
While also understanding that my brain hole doesn't always tell my mouth hole the right things to say. So I just will do a lot of,
kind of like
but the message gets across. Kind of like what?
Us accepting help.
Yeah.
So there's the hacking hypermobility hack of the afternoon. Sometimes you can ask for help. Specifically.
Can I add to that?
Yes.
Sure.
This is what my bestie taught me over the summer is just say thank you.
Mm.
So a lot of times when people are offering to help, because you're clearly, maybe could use a little help, just say thank you and remember that it probably makes them feel good too.
Yeah. Especially if they love you, Yeah.
That is a good segue into what I'm going to offer. And it's that if you are someone who wants to help, but the person you want to help maybe has so much on their plate, don't say, how can I help you? Or just let me know how I can help. If you know that there's a lot on their plate and there is something on that plate that you know how to do, ask that person explicitly, hey, can I do X chore? Because,
Yep.
and then that is much easier for the person who is under stress. And I'm speaking just from my own personal experience here. That's easier. And I would probably accept that, because if you put another task on me to come up with for how you can help me, it's not ever going to happen because you just gave me another job to do.
And we're already, as women, as mothers, a master of all the domains, running the list, considering the logistics of everything happening. What? Why? Okay, that's a whole other conversation.
Yeah, that's.
I understand that. Yeah.
Yeah.
The mental burden. Yes.
Yes. Mental effort, workload, burden, all of it. Okay. Tiffany, it's been really nice having you on the show as a guest. We are really, really thankful for the help that you offered, very specifically with your talents as a producer.
Thank you for letting me.
Yes.
And today, I've really enjoyed getting to know you better and hearing you talk about your story and sharing so vulnerably what that means to you, where you guys are at. It's powerful to the community. So thank you for contributing. So maybe somebody else will feel the things you have felt, the validation, not feeling alone, and the hope.
Yeah.
Thank you.
And thank you, everyone, for listening or watching the Hacking Hypermobility podcast today. We hope you'll engage with us on social media. We're very active on TikTok, but we know that there are other platforms. And if you're in those groups for zebras or late diagnosed ADHDers, I don't know, share a link to our show. I think they might, if you find it worthwhile, they probably will too. So spread the love, and we appreciate your help in those efforts. So,
and in terms of getting the podcast to do well in the rankings and the numbers and awareness, it helps to share it on the platform where you're listening. So wherever you're listening today, take a minute to share it, follow the show, leave us a review, stars, whatever it is, because that helps. We know we have a lot more listeners than people who have shared or followed, the account on different platforms or leave us reviews. So if it's a quick comment.
We also know you don't like being told what to do.
Yeah, so I'm not telling, I'm asking myself.
I'm just saying, like, our demographic is doesn't like being bossed around. So, and we also don't like telling you. This is so awkward. Do you hear it in our voices? Do you see my face?
We are not good at this. No.
But we know there are more of you out there. That's why we're doing this.
And the point of the show is to grow awareness. So I'm going to take in all of my inner issues with asking for help or monetization or any of that nonsense and just say, please just give us a comment or a rating, because it will help with engagement and spreading the word.
Also, if any of these topics or anything we talked about today sparked any ideas or questions that you might have and you would like to hear Shelly and Luna discuss further, please send a message to the email at info@hackinghypermobility.com, or you could tag them on the socials at Hacking Hypermobility.
Yeah. And thanks everyone for listening or watching.
Have a great day, zebras.
We're wishing you healthy hypermobility. Bye.
Bye.
Bye.